You know, it feels like more and more people are looking beyond the usual stuff for managing pain
Yeah.
and just improving how they feel, how they move. Chiropractic care seems to pop up a lot in those chats.
It really does.
This kind of hands-on, holistic thing, it definitely makes you curious, right?
Absolutely. We're seeing that too. A real growing interest in, let's say, non-invasive ways to deal with muscle and joint issues.
Which is perfect because that's exactly what we're digging into today. Chiropractic care.
Mm.
We want to explore what it really is, how it's supposed to work, and maybe help you figure out if it's something that could, benefit you.
And we've got some good material to work with.
We do. We're drawing on episode 69 of Lifelines by Supreme Medic. That one's called Chiropractic Care. Is it for you?
Right.
And also an overview piece, Considering Chiropractic Care. An overview from the Your Health Deserves a Lifeline series, both by Drs. Sirtaram Vishnoi.
Yeah, those give a really solid picture, covering the basics right through to the practical stuff you'd want to think about.
Exactly. So our mission here is to, cut through some of the noise maybe, give you a clear understanding of what's involved.
The good, the things to consider.
Right. And even what a first appointment might look like. Basically giving you the info you need.
Empowering you, yeah.
So let's jump in. At its heart, what exactly is chiropractic care?
Okay, let's unpack it. So our sources define it mainly as a manual therapy.
Hands-on.
Exactly. Hands-on. It's focused on diagnosing, treating, and also preventing issues with your musculoskeletal system.
So muscles, bones, joints.
Ligaments, tendons, the whole structure. But the spine, that's really central to it all.
That seems key. Like, even though it's about the whole system, the spine is kind of the foundation in their philosophy.
Precisely. And the main tool they use, it's their hands.
Right.
What they call adjustments or manipulations. The goal is to improve how your spine works, reduce pain, and, support your overall health.
Okay.
And there's this core belief behind it all, that your body is actually pretty amazing at healing itself. And having your spine properly aligned is, crucial for that whole process.
So those adjustments, the manipulations, they're about correcting misalignments. Sometimes you hear the word subluxations.
Yes, that's the term often used. The idea is to correct those and help the body function optimally again.
And it's not just back pain, is it? I mean, that's what most people think of.
That's the big one for sure.
But I saw mentions of neck pain, headaches, even things like joint problems elsewhere in the body.
That's right. And one source, Chiropractic Care, is it for you. Even mentioned potential links to helping with some digestive or respiratory issues for some people.
Wow, okay. So it's broader than you might first think.
It can be, because the body's systems are all interconnected, right? So sorting out the spine could potentially have wider effects.
Okay, that gives us a good starting point. Now, how does it actually work? We've mentioned adjustments, but let's get into the how and why a bit more.
Right. So the main technique, as we said, is the spinal adjustment or spinal manipulation. This involves the chiropractor applying a very controlled, specific force to a joint in the spine.
Like a push or a pull.
Yeah, a gentle, specific push or pull. The aim isn't some big, dramatic shift. It's more about restoring the natural, subtle movement and position of that joint.
And sometimes there's that pop sound.
Yes, you might hear that. It's usually just gas being released from within the joint fluid. Totally normal, usually painless.
Okay. And there's a logic behind why this might help, right? It's not just random cracking. Our sources pointed to a few key ideas. First one was about the nervous system.
Exactly. So think about your spinal cord. It's the main highway for nerve signals between your brain and the rest of your body.
Right.
If vertebrae are misaligned, the thinking is they can interfere with or put pressure on those nerves, like a kink in a hose.
Okay.
So chiropractors believe that adjustments, by correcting these misalignments, help clear that pathway. Better nerve signal flow supports the body's natural healing ability.
That makes intuitive sense. Clearer communication means better function. What's the second principle? Pain relief, I assume.
Absolutely. That's a major reason people seek this care.
Yeah.
And the research, according to our sources, does suggest it can be effective for reducing pain and improving mobility for certain musculoskeletal issues.
Like lower back pain.
Lower back pain is a big one, yes. But also things like tension headaches, even whiplash injuries. Many people find relief.
And it's trying to address the root cause, not just cover up the pain.
That's the goal, yeah. Then the third principle is about enhancing mobility and flexibility.
That feeling of stiffness. I know that one.
We all do.
Yeah.
So adjustments aim to improve the range of motion in the joints, particularly the spine. Better movement, better alignment. It helps fight off that stiffness you get from, say, core posture or other imbalances.
And the last point was the holistic view, right? It's not always just about the adjustment itself.
That's a really crucial part, actually. Many chiropractors look at the whole picture.
Like lifestyle stuff.
Exactly. They might give advice on exercises, stretches, diet, managing stress, even how your desk is set up, ergonomics.
Ergonomics, yeah.
It's all aimed at long-term health and well-being, not just a quick fix for the immediate pain. Dr. Vishnoi's overview even mentioned people getting relief from headaches just by sorting out their workstation posture.
Wow. It shows how connected things are. Okay, so we know what it is, how it tries to work. Let's talk specifics. What conditions do people most often see a chiropractor for? Back pain has to be number one?
Oh, absolutely. Far and away the most common reason.
Makes sense.
Whether it's, that chronic ache from sitting too much, maybe a strain from lifting something wrong, or just general wear and tear over time. Adjustments aim to restore alignment and ease that pain.
And neck pain seems almost as common these days. All the screen time.
Definitely. Tech neck is a real thing. Poor posture, muscle tension. Adjustments in the neck can help relieve stiffness and improve how well you can move it.
Okay. Now, headaches were mentioned too. That link isn't always obvious.
Right, but there's often a connection, especially with tension headaches and sometimes even certain types of migraines.
Really?
Yeah, they can be linked to issues in your neck and upper spine. So manipulation in those areas might reduce how often you get them or how bad they are.
Good to know. What about other joints, like shoulders or knees?
Yes, definitely. Chiropractors don't only work on the spine. They can address pain and stiffness in other joints too. Shoulders, knees, hips. Improving alignment and mobility there can make a difference.
And athletes use it quite a bit, don't they, for injuries?
They do. It's pretty popular in sports medicine. For treating things like sprains, strains, ligament problems, it can be part of rehab, helping recovery, but also maybe preventing future issues by making sure everything's aligned properly.
Okay. And one more sciatica. That sounds awful.
It can be really painful, yeah. That nerve pain shooting down your leg. It happens when the sciatic nerve gets irritated or compressed, usually where it exits the lower spine. Chiropractic care aims to relieve that pressure on the nerve.
Which could bring significant relief, hopefully.
For many people, yes.
All right. So lots of potential applications. But now, the big question lots of listeners might have, is this actually right for me? How do you decide? What should you consider?
That's the million-dollar question, isn't it? And it's really personal. First off, think about your health goals.
Okay.
Are you dealing with musculoskeletal pain? Do you prefer trying drug-free, sort of natural approaches first? If yes, then chiropractic care is definitely worth exploring.
But crucially, our sources really stress talking to your regular doctor first.
Absolutely vital. Always chat with your primary healthcare provider about any treatment you're considering.
Especially if you have other health issues.
Exactly. Especially if you have things like severe osteoporosis, any kind of spinal infection, or a history of fractures. Your doctor knows your overall health picture. Chiropractors do assess you too, of course, but your GP's input is really valuable.
That makes sense. Get the full picture.
And remember that holistic aspect we talked about. If you like the idea of a provider looking at lifestyle factors too, not just the immediate symptom, that's often part of the chiropractic approach.
Right. And it might not just be for when you're in pain. Our sources mentioned maintenance.
Yeah, that's another angle. Some people use it for long-term spinal health, regular visits, even without acute pain, as a way to potentially prevent future problems.
Okay. And the safety point is worth repeating. Generally safe with a licensed practitioner.
Right.
But not for everyone, especially those with severe bone density issues or active infections or fractures.
Right. So that initial chat with your doctor and then with the chiropractor themselves is key to ensuring it's appropriate and safe for you.
Makes total sense. Being informed is paramount.
Always.
So, okay, let's imagine someone's listened, they've talked to their doctor, and they decide, yeah, I want to give this a try. What's that first appointment actually like? It can be a bit daunting, trying something new.
Totally understandable. But it usually follows a pretty standard structure. The goal of that first visit is for the chiropractor to really understand what's going on with you.
So it starts with talking, a consultation.
Yes, exactly. An initial consultation. They'll ask about your medical history, your current concerns, what symptoms you're having, when they started, what makes them better or worse, all that detail.
Getting the backstory.
Right.
Yeah.
This helps them tailor a plan specifically for you.
Then comes the physical exam. What does that involve?
Usually they'll look at your posture, check how you move your range of motion. They'll feel around the areas where you have pain or discomfort. They might do some simple neurological tests too, like checking reflexes. And sometimes, depending on what they find, they might suggest diagnostic tests like an X-ray to get a really clear look at your spine's alignment.
Okay. And then maybe an adjustment on that first visit?
Often, yes.
Yes.
If the chiropractor determines it's safe and appropriate after the consultation and exam, they might perform the first spinal adjustment right then and there.
Using those techniques we discussed earlier.
Exactly. The hands-on manipulation aimed at restoring alignment and easing nerve pressure.
And then you just leave. Or is there more?
Usually there's some follow-up advice, post-adjustment care.
Ah, okay. Like homework?
Sort of. They might recommend specific exercises or stretches for you to do at home, maybe give advice on posture or other lifestyle tweaks to help maintain the benefits of the treatment and support your recovery.
Okay, so it's quite thorough.
It aims to be, yeah.
So wrapping this up, it really sounds like chiropractic care is, well, another potential tool in the wellness toolkit.
I think that's a good way to put it.
For managing pain, maybe improving mobility, supporting that nerve system balance we talked about.
It's a hands-on, often drug-free path that taps into the body's own healing potential through alignment.
And it's but making informed choices is key.
Yeah.
Talking to your doctor, finding a qualified chiropractor.
Absolutely crucial. Can't stress that enough. Your health, your decisions, but make them informed ones.
You know, this whole deep dive really underscores how much our musculoskeletal health matters. That idea from considering chiropractic care about it being about standing tall, both literally and figuratively.
Yeah.
It does make you pause and think, doesn't it? How much does the health of your spine influence your overall sense of well-being? And maybe prompts you to consider if exploring something like chiropractic care fits with your own health journey.
Definitely some food for thought there.